Hello, I'm Jeff Van Treese, and this is Mobilized News. We welcome you to our show as we have Dr. Bill Schaffner back on the program. Dr. Schaffner is a professor of infectious diseases at Vanderbilt University. You may have seen him on MSNBC and CNN. He was on a lot, especially during the worst months of the pandemic in 2020 and after that. So, Dr. Schaffner, thank you so much for joining us today.
Jeff, it's always good to be with you.
So let's just jump right into it. I want to get your thoughts on where we are in the pandemic as we sit here today in September of 2022. The virus has been going on almost 3 years. You know, if we look at just 6 months ago or so when you were last on, the world looks very different. I mean, you just kind of go around. You know, we recently, last week we had the Queen's funeral, as well as other award shows that we watch on TV, and it seems like we're back to the before times when we have large congregations, nobody's wearing masks. But of course, the data might not necessarily support that we're truly back to normal. So if you could just give us kind of a 1,000-foot view, where are we in this pandemic?
I think most of us would think we are past the pandemic phase and we're in the early phases of the endemic period, which is what we'll be in going forward because this virus is not going to disappear. Several considerations. One, the actual variants have changed, right? It's no longer the Delta variant we're dealing with, which was pretty darn severe. We're now dealing with Omicron and the Omicron variants, subvariants that are out there, this so-called BA4 and BA5. They seem to produce less severe disease. The other major difference that's happened is that the US population is in a different place immunologically than it was a year and certainly 2 years ago. Now our what we call population immunity is so much higher. So many people have been vaccinated to a greater or lesser degree, and many, many people have experienced COVID itself and now recovered. So the vast majority of the population, I'd say 80+%, have had experience with this virus, and that helps protect us. So I think we're beyond the really bad pandemic phase when hospitals were blasted with patients really severely ill. We're now in a more smoldering phase. I don't want to suggest it's trivial because 450 thereabouts individuals are still dying on a daily basis here in the United States due to COVID. So it's still a very, very notable virus, but it's in a more contained circumstance.